What we're doing within the practice of the rotating paramedic pilot is we work alongside GPs. Take a seat. We see patients within the practice, but also we have a second paramedic that responds to GP home visits. Working alongside the GP, because we've got the past medical history of the patients, we're able to divert those patients to more appropriate resources.
It's been widely recognised specialist paramedic skills have been underused. So now GP surgeries and nurse practitioners are recognising the facts that we can do various roles within the surgery, so we're taking a workload away from those individuals. So the GPs will give us a group of patients to see within our scope of practice. It allows the GP to concentrate on those more complex needs.
A lot of our time as GPs is taken up dealing with urgent care on the day, which is often minor ailments. Working with the specialist paramedics, it's been interesting for them learning what we do and us learning what they do beyond the basics that we all know about. And for example, I know that they can cope with a lot more of the minor ailments than I thought they could do. And one of their very important skill sets is being able to manage with patients at home and keep them at home and deal with them at the time rather than just automatically convey them to hospital.
In general practice in the 21st century, we as doctors get less exposure to acutely ill patients. Our paramedic colleagues see far more acutely ill patients, and I think that is beneficial when assessing patients with unscheduled care needs in their own home.
It's about keeping patients in the community. It's about managing patients differently and not pitching up at the emergency department by default because there's a lack of pathways. And for me, the specialist paramedic role within the surgeries is about developing pathways.
The benefits of having the paramedics on rotation rather than being directly employed by us is not only do we learn from their skills, but they learn from us as well and then take them out into the further environment to their colleagues also. And this breaking down of the barriers between the professions is hugely important for patients.
Being involved in the GP's practice, it gives me clinical mentorship, clinical leadership. It gives me a chance to practice my skills and knowledge to ensure that they're up to date. It's about what I learn here, taking into my next rotation and how I can benefit patients, not only patients, but the shared learning with colleagues.
The benefits for patients, part of this pilot, is having better sources of care to the front door.
My husband fell out of bed. We were trying to get him up in the morning to get him washed and dressed. He hadn't been well and he fell and we couldn't get him up. So I phoned the practice and they sent Gary out. It was the speed with which we got a response. So it was nice to know that somebody came, looked at the situation and realised what the problem was.
This gives paramedics something to aim for. It gives us an opportunity to show a different way of working and really responding to the patient's needs.
My advice to other practices who might consider being part of the rotating paramedic scheme is simply do it, in terms of saving time for visits that can be better spent on dealing with the more complex patients by GPs. They are invaluable.